A salmonella outbreak in 2007 and 2008 sickened 107 people around the country, mostly children. The cause? Pet turtles. Here with more information on preventing the spread of salmonella from pets to humans is our resident veterinarian, Marty Becker. Dr. Becker, thank you so much for coming back on the show.
Thank you.
So, turtles. Now, first of all, there's a new study right out in the this month's Pediatrics Journal, correct? Looking at the salmonella outbreak in 2007 and 2008. And what did the study find?
Well, first of all, I want to go back a little bit further. Let's go back to 1975.
Okay.
I was a young kid then, so I'm only like a young man. And there was all these little turtle habitats, a little plastic tank and a little ramp and a little fake palm tree that was there. 250,000 children were diagnosed with salmonella from that. So that really started things. So this is kind of small in comparison to that, but this could take back off again.
Now, is that what led to small turtles being illegal?
Exactly right. That's what they decided at the time. Any turtle under 4 inches, you might think, well, why 4 inches? What's the difference between a 3-inch turtle and a 5-inch turtle? It was thought that, children put these things in their mouth and there's more frequent contact with the smaller turtles, so that's why they outlawed them. But the American Veterinary Medical Association in 1996, about 1 million turtles they estimate. By 2006, 2 million turtles. So even though there's a ban, there's twice as many turtles in the last decade.
That's right, and we do know that they are still being sold, even though it is illegal. We know lots of places here in the city where you can still get them. Now, so we should talk about good health habits when it comes to having a pet turtle, I mean, whatever size it may be. Why is it so easy to contract salmonella from a turtle?
Well, in this latest outbreak, for example, 34 states were affected. 1/3 of those people were hospitalized. So what will happen especially is it's primarily in feces. Salmonella, you think of, transmitted in feces. And that's why, even remember in the peanut butter outbreak, it was bird droppings, rat droppings. So it's always feces that end up in some kind of food source. And with turtles, what happens is the feces gets on their skin, it gets on their shell, and with little children especially, you're going to put everything in your mouth. You kiss the turtle, you handle a turtle, then put your hands in your mouth without washing them.
Absolutely. And during this recent outbreak, some kids even swam with their turtles, isn't that right?
That's what they found in North Carolina, how they actually started. 2 teenagers are swimming in a backyard pond with 2 turtles in it, and they both got sick, and one of them ended up in the hospital with kidney failure, and luckily they're hospitalized for 8 days but lived. But it's a very serious condition.
So it can, the feces can obviously travel through the water, through, maybe you take a little drink of the water accidentally and there you go, you're sick.
Everybody that just handled them. Right. Along the way, what they found out from that North Carolina outbreak is they went back, it was the same serotype of salmonella, but all along the way, the pet stores, the flea markets, the internet, everybody's handling these turtles tank to tank, cleaning the tanks, and so it was the same serotype of salmonella.
So easy to spread. So what are the symptoms that you should be looking out for if you fear that you or your child might have salmonella?
You're going to see vomiting, you're going to see diarrhea, you're going to have extreme stomach cramps, and a high fever.
And now what will you see in the animal? Anything? Nothing?
Sometimes they'll pass without anything. So, and one thing is, it's not just turtles, by the way. You can see it in other species of animals. I'm going to be a proud grandfather here in about a month.
Congratulations.
Thank you. And there's certain things that I really fear about for this young child. And if anything that's under the age of 5, that's a threshold the Center for Disease Control talks about. These children should not be handling reptiles. So turtles, snakes, lizards. Like my daughter had a bearded dragon, my daughter and her husband, and they actually rehomed it and found a nice home for a veterinary student, actually. So Frankie's got another home. Because what will happen with children is, again, they don't realize that there might be fecal matter on their hands.
But why are reptiles more dangerous than, let's say, than other pets in terms of salmonella?
They're just one of the carriers that happens to have it more.
Okay.
So it's just more prevalent than that. You can see it in dogs and cats and horses and cattle. And another thing, in the springtime, I come from a rural background, and anybody that's ever been around baby chickens or baby ducks in the spring, you go to those farm stores and you hear them cheeping. Oh my gosh, those little baby chickens. So oh, God, listen to them. There's another place where you can actually get them. But
so the key is you got to keep your kids away from any, like if you have cats, keep them away from the litter box, right?
Yes, yeah.
And what happens if you do see them get in contact? Just wash hands thoroughly. What do you do to prevent the spread?
My mantra is always get rid of the risk, keep the pet. Okay. I wrote a book called The Healing Power of Pets, so I know there's great benefits. So we don't want to just toss all the pets out. But like if you have reptiles, don't let them have the run of the house. Can you just see that pacifier dropping onto the ground, being picked back up and put in the mouth? Never let reptiles or any pets really in the kitchen area. Never wash any pet's bowls or when you're doing things in the same sink that you're washing your own dishes in. So you might use a utility sink or someplace else separate from where you prepare food.
But you say the furry animals, dogs and cats, can also carry salmonella.
They can also
too.
kill it.
Is there any sign that we could see in our dogs and cats that they might be carrying it?
Again, you would see diarrhea.
Okay.
You would see kind of vomiting.
Okay.
But the thing you want to do, this is what my grandmother told me, and it still holds true today. Wash your hands before and after you handle a pet, and not just wash them, but you know, like a doctor. When I go to do surgery, you scrub a lot better. Go through A to Z, through the alphabet. So A, B, C, D. Wash that long until you get to Z. Always do that. And after you clean their bedding up too, or clean their tank out, that's another time you want to make sure you wash really well.
So true. As we talk about flus and viruses this season and everything else, we keep hearing how important it is to wash our hands thoroughly and properly.
Yes.
Dr. Marty Becker, thank you so much. It's a pleasure having you on the show, as always. And for more information on the Salmonella outbreak, be sure to check out the health page at abcnews.com.